Type 2 diabetes is a chronic disease that occurs when the body cannot effectively use insulin, causing blood glucose levels to spike. This condition, if prolonged without intervention, will damage various organs, especially the eyes, kidneys, blood vessels, and nerves. 1. Accordingly, people newly diagnosed with diabetes, in addition to following the doctor's medication instructions, should have an appropriate health care plan. 2. Diabetic care plan based on daily living habits. 1. Change your diet in a positive way. It can be said that nutrition for people with diabetes is a top concern, because any food you consume has the potential to affect blood sugar levels. For peace of mind, you can consult a specialist on how to plan a daily menu. 3. In addition to the above factors, you also need to pay more attention to the balance of nutrient groups through eating a variety of foods. The advice is to cut down on foods high in sugar and flour. Instead, add more green vegetables between meals to reduce hunger. 4. Regarding the portion size, you should divide into several meals a day to reduce the absorption of too much sugar at once. When eating, it is necessary to eat slowly, chew thoroughly, and eat meals on time to avoid sudden changes in blood glucose index. 3. For stable blood sugar, a balanced life, you should use more milk specifically for diabetics. Prioritize choosing milk that has been clinically proven to provide adequate and balanced nutrition, meeting the American Diabetes Association, ADA, and European, EASD, recommendations on nutrition for people with diabetes. The product is specially formulated with a slow-release powdered sugar system, so it slows down the absorption of sugar into the blood to help stabilize blood sugar, promote heart health, and help lose weight and waist circumference. You can use milk as a whole meal replacement or as a snack. 2. Pay attention to rest time. Grandparents often say, "Eat and sleep is a fairy," to talk about the important role of sleep in health. Especially in the recommendations for diabetes care, most experts recommend that patients get at least 7 to 8 hours of sleep each day. 5. Getting enough sleep will help you control blood sugar well, reduce cravings, bring a feeling of relaxation and comfort, and improve insulin's ability to work. 5. On the contrary, the disease will worsen if you fall into a state of sleep deprivation, insomnia, or experience sleep apnea syndrome. If not detected and treated promptly, this condition will lead to many serious consequences such as cardiovascular problems, especially high blood pressure. 6. To sleep better, set a fixed bedtime, avoid alcohol, beer, or stimulants, or think too much. Many people with diabetes report that they sleep better when they take a break from electronic devices 1 hour before going to bed. 5. 3. Check your blood sugar. A complete diabetes care plan cannot be complete without checking blood glucose levels every day. This is meant to help patients manage their nutrition, avoid the risk of hypoglycemia or hyperglycemia, which negatively affects health. Furthermore, through regular home blood glucose monitoring, patients can also adjust their lifestyle and exercise regimen accordingly. 7. With the traditional way of measuring blood sugar, taking a drop of blood at the tip of the finger, the American Diabetes Association, ADA, recommends that patients record their results daily. Because such information will be very useful for doctors during routine visits. Based on the data collected by the patient, the doctor will evaluate the effectiveness of the treatment and make changes if necessary. 7. Particularly for users of continuous blood glucose monitoring, CGM, devices, which use small sensors mounted under the skin to check the concentration of sugar in tissue fluids or the fluids around the body's cells, this machine keeps track of blood sugar levels. After a few minutes, the blood sugar will be measured once. A special thing is that blood glucose data can be downloaded to a computer or smartphone for patients to easily monitor. The disadvantage is that CGM has a high cost compared to traditional blood glucose meters. 8. 4. Avoid sedentary lifestyle. Exercise is a great way to control blood sugar. Exercise is one of the things you should do in your diabetes care plan. According to experts, The combination of exercise with a reasonable diet is a very effective way to help control blood sugar. 9. People with diabetes can choose appropriate forms of exercise such as walking, climbing stairs, or yoga movements to help balance the body's activities. The suggestions mentioned above are also quite suitable for office workers or those whose work has to sit often and do not have time to go to the gym. 9. You need to note that exercising at a moderate intensity, suitable for the patient's condition, will bring positive effects. On the contrary, if the exercise is not correct, the patient can face a series of risks such as chest pain due to exertion, damage to tendons, bones, joints. 10. The advice is that you should not exercise immediately after the main meal, and also do not exercise at a time too far from the meal because the risk of hypoglycemia at this time is very high. During exercise, you should bring candy, to prevent the risk of hypoglycemia. Note that diabetics with complications or comorbidities should consult their doctor before exercising. 10. 5. Check your feet. Diabetes causes many complications for the body, most commonly problems in the feet. These are the consequences of various complex lesions including 11. Peripheral neuropathy, the patient decreases and gradually loses feeling in the feet. Peripheral artery disease, patients are prone to atherosclerosis, blocked, narrow blood vessels that reduce blood flow to the legs. Infections, high blood sugar causes bacteria to grow faster, resulting in foot wounds that take longer to heal. Because of the cause of sensory disturbances and reduced blood flow to the feet, patients with type 2 diabetes are prone to conditions such as tinnitus, onychomycosis, appearance of callus, foot ulcers, common, in places where there is a lot of pressure such as the soles of the feet, the tips of the toes, hook toes, hammer toe, ingrown toenails, occurs when the edges of the hook poke into the skin. 11. From the above issues, to take care of the feet, diabetics themselves and their family members need to. 12. Check your feet daily for any damage. Keep your feet clean by washing them with warm water and mild soap every day. Pay attention to avoid soaking your feet for too long. After each cleaning, dry your feet, especially between your toes. Always wear the right size, soft shoes, even indoors. If using shoes, the accompanying socks must ensure a good fit and good elasticity. Trim toenails neatly and regularly. Taking care of people with diabetes through regular health checkups. In addition to the notes in daily living habits, people with type 2 diabetes also need to pay attention to periodic health checkups, including 1. HbA1c test. This test aims to check the amount of glucose bound to hemoglobin in red blood cells. Accordingly, people with diabetes have higher than normal levels of glucose bound to hemoglobin. 13. The HbA1c index reflects the patient's blood sugar control status in the last 3 months. Based on that, the doctor can assess the condition of the disease and give the appropriate treatment. If HbA1c is less than 6%, it means that blood glucose levels are well controlled, there is no development of complications in eyes, kidneys, cardiovascular and nervous system. 13. In the care plan for patients with type 2 diabetes, if there are no special indications, most patients would be advised to have an HbA1c test 3 to 4 times a year. 13. 2. Dental examination. As mentioned, diabetes causes many complications including dental disease. The reason is because high blood sugar damages the microvessels, thereby reducing blood flow to nourish the gums. 14. Moreover, the sugar content in the saliva of people with diabetes will often be higher than that of the general population. This creates an opportunity for harmful bacteria to multiply and thrive. At this time, bacteria will combine with food in the mouth to form plaque, causing tooth decay, gingivitis. 14. To prevent these problems from happening, the patient needs. 15. Brush teeth thoroughly after every meal. Regular dental check UPS every 6 months even if there are no abnormalities. Limit the consumption of solid foods, high in sugar and starch. Avoid the habit of smoking as this increases the risk of developing dental disease. Use dental floss to remove plaque instead of toothpicks. Use physiological saline to rinse your mouth after each meal. 3. Eye exam. According to many studies, high blood sugar can lead to eye diseases such as cataracts, blurred vision, glaucoma, severe eye pain, decreased vision, even is damage to the retina. 17. Therefore, for people with type 2 diabetes, eye care and protection is essential. 16. Because of these problems, the American Diabetes Association recommends that people get their eyes checked as soon as they know they have the disease. Because 1 in 5 people with diabetes have eye diseases just listed. 8. To prevent eye complications, patients need to try to keep blood sugar stable, should have regular eye exams at least once a year. Particularly, pregnant women with gestational diabetes should have an eye exam every 3 months to ensure their health. If you notice any strange signs, go to the hospital immediately. 17. For vaccinations. Vaccination. Vaccination is also an important part of a long-term diabetes care plan. Because this will help patients cope well with pathogens from the environment. 18. Remember, diabetes weakens the immune system, so the patient is at risk of contracting infectious diseases. If accidentally infected, the rate of patients having complications or even death is very high. 18. The vaccines that people with diabetes need to get vaccinated are influenza, pneumococcal, hepatitis B, diphtheria, pertussis, and tetanus vaccines. In addition, doctors may also recommend that patients get the chickenpox vaccine, zoster. 18. Care plan to protect diabetics from stress. Stress and fatigue are huge obstacles to diabetes control. Accordingly, when the body and mind are in a state of stress, hormones such as adrenaline and cortisol are secreted, leading to an increase in blood sugar. In addition, insulin resistance, the hormone that lowers blood sugar, is also promoted. 19. So, to dispel stress, here are a few tips you can take. 1. Need to be more open in communication. Living with diabetes is not easy. Sometimes you will feel there is too much pressure on your shoulders. But don't let that keep you in your heart, share your burden with your loved ones. You'd be surprised to learn people care more about you than you think. 8. 2 pets. Having diabetes makes it very easy to feel lonely, which, if long-term, can lead to serious depression problems. To avoid this, try taking care of a dog or any pet you like. Having someone to keep you company is a great idea to eliminate loneliness. 8. 3. Immerse yourself in nature. Many studies show that walking under a tree has a great effect on reducing stress hormone levels, regulating heart rate and blood pressure very well. Patients themselves or caregivers of diabetics should be more concerned about this. 8. Hopefully, through the above article, you have understood a bit more about the diabetes care plan for both the family and the patient in a reasonable way. Do not hesitate to share your difficulties and problems with your doctor or loved ones to control your condition better and better.